Hi guys, my name is Jessica Espinal, and I'm going to be talking about adherence and mental health issues in chronic diseases such as diabetes, heart diseases, HIV, and AIDS. So, adherence to treatment, the definition I found on the World Health Organization is the extent to which a person's behavior, taking medication, following a diet, and or executing lifestyle changes corresponds with agreed recommendation from a healthcare provider. So, adherence is influenced by perception of personal risk, decision support, motivation, self efficacy, and creditable health information. Poor medication adherence is pretty common, especially in chronic illness, and is associated with poor outcomes. So this is a neat diagram that I found on the SAMHSA website. It kind of shows a percentile of adults that are non-compliant, well, non-adhesive towards their treatment and medication. So as you can see, it's a pretty large percentage. Some of them are chronic illnesses on the list. Some of them aren't, but yeah, this is just an idea. So working with unique populations, there are a few reasons why working with this population is different from working with others. So a few are listed here below. If the patient is not adherent to treatment, they lack progress in treatment and may regress in their overall treatment as well. So this population will constantly be admitted into the hospital and the ER due to their medication non-adherence. So for example, let's say diabetic patients, if they're not taking their insulin as they're supposed to, they're at higher risk of pretty much coming back into the hospital and being admitted. Same with patients who have like high blood pressure and heart diseases and stuff like that. So people who also present with a mental health disorder, such as like schizophrenia or depression, may not adhere to treatment compliance due to their degree of possibly their diagnosis, and maybe because they're not taking their medication, which may be affecting their cognitive level of functioning and decision making skills. So let's move on to the next one. Okay, so there are a few challenges that this population does face. Chronic diseases that the patients have, such as heart disease and HIV, have no cures, as most of you guys know. So a lot of them are progressive. So sometimes there is treatment for the diseases, but there is no cure. Most chronic diseases are progressive again. Therefore, the patient and family have to adjust to any medical changes. For example, if a patient anything from lifestyle, like if a patient becomes pregnant, they gotta modify some life changes. If the patient um, becomes like obese and stuff like that, they also gotta modify their eating habits and nutrition. Chronic diseases may cause lifestyle changes for the patient. Again, sometimes depending on the chronic disease, they may need more exercise, or they may not be able to walk as much, or they may need again more social support to get them through their day or through their routine, or just general lifestyle. So, due to the complex medical treatment procedures, patients may be adamant about treatment and may not fully understand the depth of the treatment and its importance to poor cognitive skills. So again, sometimes it's difficult to have a patient be adherent to their treatment because they have poor cognitive skills. So, so this is again a neat diagram that I found on the SAMHSA website. This shows some of the reasons why patients are non-adhesive towards their treatment. So some of them are related to stigma, adverse drug reactions, homelessness, substance abuse, memory problems, lack of social support, afraid of medication, denial of illness, lack of trust in provider, and sometimes difficulty with regimen. Again, some of these that we can, as social workers, all help them out with. So, a Network for Intelligence in Health Innovations 2006 study shows that non-adhesive adherence, among diabetic patients led to an increase in rehospitalization. So this study also shows that diabetics and heart disease and patients with heart disease, non-adherent patients, were 12.1% more likely to risk death when compared to 6.7% for adherent patients. So again, a lot of people are readmitted into the hospital when they're non-adherents towards treatment or medication or recommendation from a medical professional provider. In a study conducted by Olfen et al., relapse among schizophrenic patients averaged at 35% for adherent patients, while it increased to 75% for non-adherent patients. So again, this relates to mental health. So those patients who were schizophrenic and they did not comply with treatment requirements were more likely to be at risk for relapsing. So how to assess this population, the population needs as a social worker. So as a social worker, it's important to identify and access the adherence problem the patient may be dealing with. That may include some stuff like lack of social support, poor lifestyle, and sometimes health beliefs. Again, sometimes maybe their nutrition as well, what they're eating, which it's included in like lifestyle. So the social worker is also responsible for treatment planning and ensuring that the patients, more than just their bio, their psychosocial, is taken into consideration. Because obviously we know that in the hospital setting, in medical setting, they're looking at their bio, their body, what medications are working. But we as social workers can look at more of their psychosocial portion. So the social workers must communicate effectively with the patient and interdisciplinary team members and ensure that the patient desires are respected. So social workers must work with the patient to initiate new behaviors through the use of including, again, family support, more than family, also friends, maybe the community where they work, the use of role playing for challenging moments as well. Again, we can prepare them for high risk situations and utilize cognitive behavioral therapy to teach the patient coping techniques. So to teach them when they feel like they're going to relapse, what high risk situations may be best for them to kind of implement a coping skill that is healthy. Again, maybe calling their social support to help them out. So social workers can also educate their patients on topics related to their ongoing conditions for treatment adherence. Just giving them basic knowledge. I know a lot of patients may not know exactly what they're going through. Again, that's like their health beliefs, and they may not totally be willing to comply with treatment because they don't trust the medical staff possibly. So social workers can assist patients with setting a reminder to take their medications as well as prescribed, and also educating their family members on how best to assist the patient. So again, there's a lot of ways social workers can help in this realm of treatment noncompliance. So again, I just put this in here. Interventions used by social workers. With this population, we can use cognitive behavioral therapy. That's a big one. Again, that goes back to like planning, relapse planning. Motivational interviewing skills. Again, that can be used to just kind of encourage the patient to make sure they're doing what they're supposed to. They're taking the medication as prescribed. They're feeling well, and they just can interact and let us know how they're feeling emotionally. Psychoeducation, again, relating back to just providing information about their ongoing chronic diseases. Again, maybe new medications that they have to take, the reasons, some side effects that they'll experience. And relaxation techniques. So it's nice to also possibly teach them relaxation techniques, especially patients who have chronic diseases, because with the chronic disease also comes sometimes some anxiety, some depression. The patient doesn't know exactly what's going on, maybe how much time they have to live. So possibly just teaching them ways to kind of relax in moments of high stress. So resources as a social worker. So again, as a social worker, I would need to be educated on the patient's medical condition in order to best assist the patient. So I would want to know like what chronic illness they have, and possibly what's the long term of the illness, short term for the illness, medications that what the medications do to their body and brain. The social worker must have knowledge of the client's cultural background, and we want to conduct research based on the client's culture, which may affect the patient's adherence to treatment. So it would be nice to know, the patient, their religious beliefs, their, again, uh, just cultural, where they come from, maybe their family background, just to kind of get an idea of their history and where they're coming from. A social worker may need to contact the client's primary care provider to obtain a better history of the patient's adherence. So I do know also, again, medical staff will get to know, before I probably would know as a social worker, but I would also want to know the patient's history, possibly by talking to maybe interdisciplinary team members or the prior primary care provider to see what medications they were taking and what they were on. So some resources needed by the client, possibly insurance. Maybe if they don't have insurance, it would be nice for the social worker to just kind of like easily make sure that they have the paperwork that they need. Maybe communicate with their family and their support system to see if they can be enrolled in some type of insurance. Transportation, again, making sure the patient has access to transportation, which is a big one. A lot of times, without transportation, the patient isn't able to pick up their prescriptions as they're supposed to, if it's monthly, daily, whatever it is. So that's a big one, just making sure that they have access to some type of transportation. Peer support, again, that includes family, friends, and if they don't have family and friends, making sure they have community peer support. Mental health providers, again, if they have been diagnosed with something, or if we feel like something's going on with their mental health, making sure that they are connected with community mental health. And a nutritionist, depending on, again, their chronic disease, they might need to change their lifestyle and what they eat. So they may need to be educated by, again, a nutritionist, someone maybe that could go out to the home and he could, shop with them, let them know what's going to benefit them right now in their time of need. So my skills as a social worker, that kind of, what was the question, makes it different from all the other team members. So in working with this particular population, I would build a positive working rapport with my client so that they may feel comfortable. I would develop a trusting and caring relationship with my client over time through the use, again, of empathy and active listening. I would encourage my client to be part of his or her decision-making process. I would also instill hope with my client and reassure them about their adherence and treatment and remind them of the benefits associated with adherence. And I would keep them into account, about their personal beliefs and cultural beliefs as it relates to their desires and expectations in treatment. And these are my resources. So I hope you guys enjoyed my slideshow and learned a little bit about medication adherence and adherence, with mental health populations. Thank you.